Hello everyone, welcome back on my channel. If you are new on this channel, thank you for passing by. You're most welcome. And those who are old on this channel, thank you for sticking around. I really appreciate. If you would like to join this channel, just subscribe, hit that notification bell. You will be notified every time I'll be uploading a new video. My name is Kabuye Sandra, and on this channel we deal with health and beauty. For today's topic, we are talking about painful periods, dysmenorrhea. And by the end of this video, we will know what is dysmenorrhea, what are the types of dysmenorrhea, and what are the causes of dysmenorrhea. And we will look at the treatment of these painful periods. First of all, if you don't have painful periods, just put a cross in your face and thank God, because it is so painful. What is dysmenorrhea? Dysmenorrhea is that pain associated with menstruation. This pain can last for around 2 to 3 days, and it can be mild, but sometimes it is so severe that most women, they can't even do anything when they are menstruating, when it becomes so severe. So what are the types of dysmenorrhea? We have the primary dysmenorrhea. This is the type of pain that you get maybe before starting the menstruation or during the menstruation period. But this one, it can be painful at the start, and it decreases as the days goes on. And then we have secondary dysmenorrhea. This is the type of pain that starts even before the start of the period. It becomes more during menstruation. It becomes severe at the end of the menstruation, and most of the time it stays even after menstruation. So let's see what causes primary dysmenorrhea. What causes that primary pain? Primary dysmenorrhea is caused by a chemical called prostaglandin, and this is made in the lining of the uterus. This chemical, prostaglandin, causes the muscles and blood vessels in the uterus to contract. So on the first day, it is high. On the first day when you have started your period or during menstruation, this chemical is high. And as time goes on, when you are menstruating, because the lining of the uterus is shedding, the level of prostaglandin decreases. That's why the pain lessens as the days goes on. The first or the second day you will feel pain, a lot of pain, but as the days goes on, the pain lessens. This primary dysmenorrhea starts when a girl gets her periods. It lessens as a woman gets older, and it really decreases after giving birth. So when you have that cramping, it improves as you get older. Sometimes it stops. Sometimes when women give birth, it really disappears. That is primary dysmenorrhea. That is the crampings you get. So the second one, we have the secondary dysmenorrhea. Now, secondary dysmenorrhea is caused by a disorder in the reproductive organs. This one tends to stay longer than the normal menstruation cramps. It may start at the beginning of the menstruation, before you begin your menstruation, like days to the menstruation. It keeps on during menstruation, and it can also stay even after menstruation. The primary dysmenorrhea, as you have seen, it is quite normal. It will come, you can take some medications, and as the period goes on, it lessens, okay? That one are the normal cramps. But now in today's topic, we are interested in the secondary dysmenorrhea, which is abnormal. Let's see what are the causes of this secondary. Now, number one of the causes, we have endometriosis. This is the situation where a tissue similar to the lining of the uterus grows in other body parts. For example, it can grow in the fallopian tubes, it can grow in the ovaries, and it can grow in the bladder. Like the lining of the uterus, this tissue breaks down and bleeds due to hormonal changes. And it bleeds sometimes during your menstruation, and it causes a lot of pain. And sometimes it can cause a scar tissue in the pelvis. Secondly, we have fibroids. Fibroids are those growths that form inside, outside, all in the walls of the uterus. But those fibroids that grow in the walls of the uterus causes pain. They cause a lot of pain. But small fibroids, they don't cause that much pain. But these ones that grow in the walls of the uterus causes pain. The third cause, we have adeno meiosis. This is when the tissue that normally lines the uterus starts to grow inside the muscle. So, and this normally happens to women who are older, those women who have already given birth. Due to some complications, they get such a problem, and they start at you've already had children, and you begin to have those heavy cramps. So other conditions, we can have urinary disorders, and there are some women that are born with disorders on the reproductive organs, like the fallopian tubes, the ovaries, and these problems, they were born with them. They can also cause severe menstrual cramps. So let's see, how can you help yourself at home? If you always receive these menstrual cramps, you must not miss a hot pack in your house. When they start, just get a hot pack and press it on your lower belly to ease the pain. And sometimes before the beginning of your periods, you go and get some NSAID medications like ibuprofen. They can help you to ease the pain. These ones, they can help you to decrease on that chemical prostagland, and it lessens it, and in return it will help you to slow down the menstrual cramps. And also always take hot showers if you have these menstrual cramps. And also meditate and relax in your bed and be in one position, and you will ease the pain. But if the pain is severe, you've done everything, even the medications are not working, this is when you are going to see your gynecologist. A gynecologist will carry out laparoscopy. This is when they cut a thin line below your umbilical cord, and then a thin camera is put inside to see what is happening inside, if the medications and everything is not working for you. So if they find out that the cause is endometriosis, if your gynecologist finds out that the cause is because of endometriosis, then this is when you will take hormonal birth control pills to stop the pain. With fibroids and with fibroids, this some small particles are put in the bloodstream, and they cut off the supply of blood of the fibroids to the tissues, and then the pain will stop. Sometimes it comes back, or sometimes it goes forever. Meiosis also is the same as fibroids. The particles are put into the bloodstream so that the blood is cut off. So, where do you lie? Where do you lie? Do you have those severe menstrual cramps when you take medications, are they going or no? So I think by the end of this video, for those who are still with me, you now know where you lie. When you get severe cramps and they're not going, you've tried everything, just go to your OB-GYN and then he will tell you what to do next. Thank you for listening. Thank you very much. Please subscribe, share this video, hit the notification bell, and I will see you in the next video.